Yes, good afternoon, ladies and gentlemen. So today we are looking at benign prostatic hyperplasia. That is our topic. The course is BCH 405, Advanced Topics in Biochemistry. Yes, we are looking at what is benign prostatic hyperplasia? Benign prostatic hyperplasia, also known as BPH, is a condition in men in which the prostate gland is enlarged and though not cancerous. Benign prostatic hyperplasia is also called benign prostatic hypertrophy or benign prostatic obstruction. The prostate goes through two main growth period as a man ages. The first occurs early in puberty when the prostate doubles in size. Then the second phase of growth begins around age 25 and continues during most of a man's life. Benign prostatic hyperplasia often occur within the second growth phase. As the prostate enlarges, the gland presses against and pinches the urethra, such that the bladder wall becomes thicker. Eventually, the bladder may weaken and lose the ability to empty completely, leaving some urine in the bladder. So the narrowing of the urethra and urinary retention, the inability to empty the bladder completely cause many of the problems associated with benign prostate hyperplasia. The prostate is a walnut-shaped gland that is part of the male reproductive system. The main function of the prostate is to make fluids. Yes, to make fluids that is essential for a man's fertility. The gland surrounds the urethra at the neck of the bladder area where the urethra joins the bladder. The bladder and urethra are part of the lower urinary tract. You see, so that's it. Benign prostatic is the most common urological condition among elderly males, affecting approximately half of men over 80 years of age. Studies have associated BPH pathogenesis and progression to oxidative stress. So currently available BPH treatment includes surgery, as well as pharmacological therapy with alpha blockers or 5-alpha. The present BPH medication, however, are linked to a number of adverse effects, including reduced libido, erectile dysfunction, indigenous retrograde ejaculation, and orthostatic hypotension, necessitating the search for alternative treatments. Plants appear to be the best option for the search. Thank you for listening. Now, next class, we are going to look at the pathology proper of benign prostate hyperplasia. Thank you for listening. May God bless you. So what we are looking at is this. If you look at this diagram, you will see the bladder, and then you see the prostate, two walnut shape. You will now see the urethra. So the prostate presses on the urethra as it gets enlarged, and over time, the bladder will not be able to empty urine completely. In fact, it's the pain associated with the urinary retention of the bladder that makes this disease an uncomfortable disease for somebody. So we advise that men because this disease actually it starts happening around 60 years. It becomes obvious. So we are looking for treatments for it now, and then there are studies going on the use of herbal medication for the management and treatment of this disease. So for now, we will be looking at it in detail in our next class. We'll be studying it in detail in our next class. So thank you very much for listening attentively to me. May God bless you all. So later we are going to do the practical of this class in the next class. We'll look at it very well.